If you've got knee pain from osteoarthritis, you've probably heard one piece of advice over and over and over again. It's always been seen as the gold standard, the first thing to try, the one thing everybody agrees on. But what if the science behind that advice is, well, a lot more complicated than we've been led to believe? Let's dig into what the very latest research is telling us. So first, let's just get a sense of the scale we're talking about here. Globally, an estimated 365 million adults are living with knee osteoarthritis. That is a staggering number of people, all looking for some kind of relief. And for decades, the answer has seemed pretty darn clear. You know the one. You hear it from your doctor, your physical therapist, your friends, even that one person at the gym who seems to have an opinion on everything. They all point to the exact same universal recommendation. Yep, just one word: exercise. It's been the cornerstone of managing knee OA for as long as any of us can remember. And the logic, it seems pretty simple, right? Just move more and you'll feel better. Well, this is where our story gets really, really interesting. Because while no one is saying exercise is a bad thing, a whole new wave of super high-quality clinical trials is adding a surprising and, frankly, crucial twist to this old belief. Okay, so before we jump into all the new stuff, let's just set the stage. For decades, exercise wasn't just an option for knee OA, it was the option, the undisputed first-line treatment recommended for literally everyone. And look, this isn't just some old folk wisdom. It is baked right into the official clinical guidelines all across the world. The experts have consistently pointed to exercise no matter how old you are or how bad your symptoms might be. The science really seemed to be completely settled on this. Back in 2015, a massive Cochrane review, which is kind of like a super study that pulls together tons of other trials and is considered the absolute gold standard of evidence, well, it looked at 54 different studies. The conclusion was crystal clear: exercise works. In fact, the authors were so confident, they basically said future studies probably won't even change this finding, case closed. Or so we thought. But here's the thing: things are starting to change. In just the last 5 years or so, brand new research has started to poke some pretty serious holes in that old certainty. The story is getting a whole lot more nuanced. Now, just take a look at this slide. The comparison here is just wow. Look at the difference a few years makes. The updated 2024 Cochrane review found that the benefits of exercise were actually small and, get this, of uncertain clinical importance. And that high certainty from 2015, yeah, that's been downgraded to low or moderate, with the authors pointing out a high risk of bias in a lot of the older studies. This is a huge, huge shift in the scientific consensus. So what happened? Why this dramatic change of heart from the scientific community? Well, the answer lies in a few recent, really innovative studies that compared exercise to something completely unexpected. For instance, check out this high-quality trial from 2022. It compared a popular supervised exercise program with a simple saline or saltwater injection. I mean, it's basically a placebo. And the result? The exercise program was no better at reducing pain. They both had an equivalent effect. This suggests something else might be going on here. And that something else might be what researchers call contextual effects. Think about it. The supportive environment, your own belief that a treatment is going to work, the positive interaction you have with a therapist, all of these factors, the whole experience of getting care might be what's creating the benefit, not just the physical exercise itself. Okay, so this leads us to the next part of this whole puzzle. For years, we've held two other beliefs as total gospel. First, that more exercise is always better, and second, that you absolutely have to stick with the program perfectly to see results. So, let's see what the new data says about that. I mean, it's the common sense question, isn't it? If a little bit of exercise is good, then a whole lot of it must be great. We all just assume there's a clear dose-response relationship. But surprise, surprise, the data just doesn't seem to support this. That simple, straight line of more exercise equals less pain isn't really what researchers are finding. It turns out just cranking up the intensity or the volume doesn't seem to guarantee better results at all. In fact, recent trials found no significant extra benefit from doing higher intensity training versus lower. They found no real difference between exercising 6 times a week or just twice, and even adding more sets and reps, it didn't really move the needle. The whole more is better mantra just isn't holding up under scrutiny. So if more isn't better, then maybe the secret is just consistency. Adherence, right? You have to do the exercises exactly as prescribed, day in and day out. That has to be the key. doesn't it? And again, we get a pretty counterintuitive finding. When researchers actually looked at the data, they couldn't find a strong, clear link between how well patients stuck to their exercises and how much their pain or function actually improved. This points right back to those contextual effects we talked about. Maybe it's the simple act of engaging in care that matters, more than the nitty-gritty specifics of that care. So, what's the crucial point here? If the benefits of exercise are less about the specific movements or the dose, and more about these really powerful contextual effects, what does that mean for how we treat people? Well, this new research actually opens up some really exciting and practical new paths forward. And technology is totally leading the way. First up, studies show that digital programs, on websites or apps, can be really effective and safe, which makes care way more accessible. Second, remote care through video calls is proving to be just as good as in-person visits for both pain and function. And third, a blended, stepped approach that starts with digital tools can help about a third of patients avoid more intensive and expensive care altogether. So while making care more accessible and supportive is definitely key, maybe the most powerful tool we have doesn't have anything to do with reps or sets. It might just be the words we use. Just look at the difference here. On one side, you have this negative, scary language like wear and tear or bone on bone, which really just frames your joint as this fragile, broken machine. But on the other side, we have empowering language that focuses on what you can do, on building your confidence, on your own capabilities. This shift in how we talk about it is proving to be incredibly important. And this isn't just some nice theory. A recent randomized controlled trial found that using this empowering participatory language led to real measurable benefits. Patients actually reported less fear of movement, a much greater belief in their own ability to manage their pain, and way higher motivation to actually get active. And that brings us to our final, big, thought-provoking question. The latest science is really suggesting that exercise for knee OA isn't a simple prescription. The benefits seem to be deeply tied to all those contextual effects, the experience of care, our own beliefs, and the words we use. So what if the conversation we have about osteoarthritis is just as powerful a treatment as any physical exercise we could ever prescribe? It's a fundamental shift in thinking for sure, and one that could totally reshape the future of knee pain care.